so from the Great Lakes of the USA to the southern Argentina. But 13 species are found in the Old World tropics. So all medically important species are, however, confined to the southern USA, Central and South America. So triatomines are commonly called as kissing bugs or cone nose bug. So triatomine bugs are vectors of the protozoan parasite T. cruzi, which causes Chagas disease. So about 6 to 7 million people are estimated to be infected worldwide. So mostly in the Latin American region where the disease is endemic. So in later years, T. cruzi became a public health concern also in the United States and other non-endemic countries, mostly due to human immigration. So the Triatomine vary from 5 to 45 millimeters in length, but most are 20 to 30 millimeters long. So they are easily recognized by their long snout-like head with a pair of prominent dark-colored eyes, in front of which is a pair of a laterally situated, long and thin four-segmented antennae. So the proboscis, sometimes is called the rostrum, is relatively thin and straight. So the dorsal part of the first thoracic segment of the Triatomine consists of a very conspicuous triangular pronotum. The meso and the metathorax are hidden dorsally by the folded forewings called hemelytra. So the basal part of each hemelytron is thickened and relatively hard. So whereas the more distal part is membranous. So the hind wings are entirely membranous, but when the bug is not flying, they remain hidden underneath the hemelytra. So the 11-segmented abdomen is more or less oval in shape, but is mostly hidden by the wings, except for the lateral margins, which are bent upwards slightly and are visible dorsally. So the Triatomine are frequently brown to black colored. But some species are more colorful, having contrasting yellow, orange, pink, or red markings. So usually as bands on the pronotum, the basal part of the forewings, legs, and or the abdominal margins. So the life cycle is hemimetabolous. So small pale nymphs, which resembles adults but lack wings, may hatch from eggs after 10 to 15 days. But the incubation period may extend to at least 30 to 60 days. So there are 5 nymphal instars. Each are requiring at least one blood meal before it changes into the succeeding instar. So the rudimentary wing pads are visible in the 4th and the 5th nymphal stages, but only adults have fully developed wings. So young nymphs can ingest 6 to 12 times of their own weight of blood. And their abdomens may become so greatly distended that the 5th and the last nymphal stage takes about 3 to 5 times its own weight of blood, while the adults ingest only 2 to 4 times their weight of blood. So the adults of some species ingest 300 to 400 milligrams of blood at each meal and feed every 4 to 9 days. So the nymphs and the adults of both sexes feed at night on their host. So the feeding often lasts for about 10 to 25 minutes. So the people covered with blankets are beaten on unexposed parts of their body. So the eggs of the Triatomine are about 1.5 to 2.5 millimeters long, oval in shape, but have a slightly construction before the operculum, which is the cap part, and then the smooth and the ornate shell, which is very pearly white, pink, or yellowish depending on the species. So the eggs are deposited in cracks or the cracks in the walls, floors, ceilings, and furnitures of the houses. Some species lay their eggs in the rodent burrows and other shelters used by mammalian hosts upon which they feed. So the females lays 1 to 2 eggs a day. So a total laid varies from 50 to 1,000 depending on the species and their longevity and the number of blood meals they also take. So but usually it's only 200 to 300 eggs. Okay, so in Latin America, T. cruzi parasites are mainly transmitted by contact with feces or urine of the infected blood-sucking triatomine bugs. So normally they hide during the day and become active at night when they feed on animal blood, including human blood. So they usually bite on an exposed area of the skin, such as the face, and the bug uh, defecates or urinates close to the bite. So the parasites enter the body when the person instinctively smears the bug feces or urine into the bite or any other skin break, so the eyes or the mouth. So about 70 triatomine species have been recorded naturally infected with T. cruzi. So in a study by Ramos, Sesma et al. In 2021, they have different approach in achieving control of the Chagas disease, which they educate the people from rural areas in parts of South America. So first is they assess on what level of knowledge of the people regarding the Chagas disease. Followed by this, everyone undergone serology tests to determine whether they are infected or they are not. So based on the results of their study, more than half or 64.8% of the participants were at least knowledgeable about the Chagas disease, most of which are from Bolivia.